Good morning, everybody. It's Heather Summers. It's October 25th, and I am at Lawrence Memorial Hospital here in New London. I am the co-chair of public health, and as such, I thought it was very important, seeing as it's Breast Cancer Awareness Month, to make people aware of what it's like to have a breast exam. Shortly, I will be undergoing my mammogram, and we will be able to walk through exactly what's happening so we can show folks, particularly women, that it doesn't hurt, it's not painful, it's quick, and it's very important. We have a wonderful radiologist here at Lawrence who will be walking us through the process and talking about the state-of-the-art equipment that they have available here at the Lawrence campus in New London, and they also have the same equipment available at the Pequot facility in Groton.
And here at Lawrence, we have recently switched over to all new mammographic equipment. It's referred to as 3D mammography, but we call it, the scientific name is tomosynthesis. So we've upgraded all of our units here at Lawrence, as well as at the outpatient sites at Pequot and in the Crossroads Imaging Center. And it's really top-notch technology, allows us to really get a great look and to look for subtle cancers that we might otherwise not be able to see. So we're very excited about the technology.
Hi everybody, it's Senator Summers back again. I am actually in the mammogram room right now over here is the 3D mammogram, the state-of-the-art equipment, and I'm with Daphne, who is a breast imaging specialist here at Lawrence Memorial Hospital. She's going to be doing my exam today. I want to recommend, again, everybody get screened. It is Breast Cancer Awareness Month, but again, Connecticut has the highest rate of breast cancer of any state in the nation. 1 in 8 women will develop breast cancer. There is some controversy as to whether you should have an exam every 2 years after the age 55 or every year, but it's up to you as a woman to make that decision. For me personally, I would like to be checked every year just to be sure and just to be safe, because a lot can happen in a year.
Yeah, exactly. It certainly is an art, yep.
And we're in the final stages. We had the breast exam, and I am here with Dr. Blue and Dr. O'Connell, and they are going to walk through and talk to us about what they're looking at on the screen here for my image. I just want to tell everybody they were gracious enough to put this image up quickly for me today so that we could finish this documentary of what it's like to have a mammogram. Normally it would take a couple days for the images to be read, and then you would hear about the results through your primary care physician or your OBGYN or whoever ordered it. So this is absolutely not normal turnaround time. I want to make sure, again, the hospital and the 2 physicians here have been gracious enough to be able to pull this up right away so that we can look at it and they can explain to you what they look for. So I'm going to turn it over to you so we can look at the screen here. This is Dr. O'Connell. She is the person who's reading the images today.
This has how we typically look at a mammogram. We might have every radiologist is a little different in how they set it up, but we would typically have the current exam across the bottom, and there's 2 images of each breast, and then we'd have priors across the top, and then we just kind of scroll through. We can look at each breast individually. And we look for abnormalities such as calcifications or a mass or...
And what would that look like on the screen if you were to find that?
So a calcification would look, you don't actually really have very many in so, but
Okay.
it would look like a very bright white spot.
Yesterday I had the pleasure of speaking with a Yale professor who's in charge of biomedical research and breast imaging, and she indicated to me, which is something that I did not know, that Connecticut has the highest rate of breast cancer of any state in the nation. I don't know if that's because we do a better job screening or what the circumstances are, and neither does she. They're trying to figure that out, but that just is even more important for every woman to get screened for breast cancer. 1 in 8 women will have breast cancer in their lifetime. So I'm here to encourage you with Breast Cancer Awareness Month to get screened. If you don't have insurance, that you can call the Department of Public Health and they can forward you to somebody who can help get these images or this mammogram done at free or reduced cost. If you're interested, you can talk and call Lawrence Memorial Hospital, and they can find you somebody who can either write you a script, or pretty soon you're going to be able to sign up and just sign up for a mammogram here. So please get checked, and we'll see you soon.